Hello, my name is Steven Chizirungu. I'm a Kepler student, and today I'm going to pitch the evaluation of using social media in healthcare industries. Starting from the definition of social media, we have seen that social media is a tool which is being used to interconnect a person with another person. So we have seen the evaluation of how social media have been used in healthcare industries. Starting from the United States of America, you have seen that currently healthcare industries are using social medias where they are being connected, keep in touch of healthcare providers with the patients. Currently, we have seen that in the United States of America, a patient can be able to request an appointment with a doctor, and a doctor is able to accept the invitation of the patient, and it was really helpful. They say that social media is being used in their daily activities. We have seen that also physicians are using social media when they are making research on or learning from other expertise, where we found that a doctors can be able to connect with another doctors who maybe has more skills or is expert with in any disease, and be able to learn from him, and you understand that they use social media while they are gaining more skills in their career. Also, we have seen that social media is being used in healthcare industries in the United States, where they are using social media in terms of marketing their products, where we found that healthcare industries or healthcare institutions are using social media to advertise the product that they are launching, and the patient are able to know what is the new medicine that are on the market by using social media of those the institution of those healthcare industries. Also, we found that also not only in America but also in Europe, those developed countries are using social media by developing the healthcare services. Also in Europe, we found that they are using physicians are using social media, learning from others, in connecting with the patients. Also they are using social medias in internal communication, maybe within the institutions, where we found that maybe they use social media like Gmail or Facebook or Twitter account, where they want to communicate within the same organizations. Also, though we emphasized on United States of America and Europe, we found that also in Africa, since the healthcare services in Africa is being developed, we found that also in Africa, social media is playing a great role in healthcare industries. We found that there are many hospitals and other healthcare institutions which are using social media on the side of connecting patients with their medicine, or how they can treat those patients by through connected with on social medias. We found that majority of hospitals in Africa are using social media, and they say that in Africa also social media is being used in healthcare industries, and it is really helpful for patients with doctors to connect easily, and also requesting some appointment on via social media. Also, on the side of healthcare provider, they say that they use social media when they communicate. Maybe one institution with another institution, they use social media when they want to communicate with any informations. apart from those advantages of using social media, we found that there are some issues or challenges that social media is being used in healthcare industries. We found that majority of those people working in healthcare industries are not aware, or they don't use social media for using professionalism ways. We saw that sometimes we might find that institutions or healthcare institution is posting some unrelated information of the patient, or they use unrelated information of the maybe if there is an employee of that institution who made a marriage, they can even put some pictures or the information of the marriage on the account of social media, on their account. Why the social media account they have created, it was only for the purpose of using it as providing healthcare information or connecting with the patients. So, based into the different challenges that we found on the using social media, apart from providing unrelated information, we found that there is also another issue of using social media where we found that healthcare institutions sometimes it happens that they can even post the informations of the patient without the permission or regardless of the policy of posting the information on social media account, where we saw that sometimes we might find like pictures or the informations of a certain patient or no, so on the social media account of the institution without the permission of that patient, and basing on to the rules and the regulations of posting the information of the patient on social media, we found that that is something which is unethical to be posting the information of patient on social media without the permission from the owner. We found that it is unethical things to do. Since we found that social media is playing a great role in healthcare industries, we found that those challenges that that is being affected in healthcare, we found that we can suggest some solutions to those problems. We have found that if the healthcare institution has a social media account, either on Facebook, Twitter, or Instagram, they can use that social media account for the purpose of healthcare services or the healthcare information. If healthcare providers have some personal information, they can use their personal information on their personal account, not mixing the information of the patient with their personal account, or posting the information of their personal information with their the institutional account. That is the one things that they should do. Also, another suggestion for that is that through posting the information of the patients, they should be aware and request the permission of the patient or the owner of that information. If maybe a patient is sick, they should say, could you please give us a permission to take you a pictures and then post it on the social media account of the institution, since it might even be beneficial to the patient or to the healthcare institutions. If the patient accepted the information of if the patient accepted the information to be posted on their social media account, that is will be a ethical things, or the info that will be well done. Thank you for watching the video, and I hope that it will be so helpful. Thank you.